Imagine feeling calm, focused, and full of energy all the time. That would be very nice, but is it possible? Today's topic is ashwagandha, an ancient herb that has been changing lives for thousands of years. And I have to say that I see its beneficial qualities at our functional medicine clinic all the time. But before I dive in, I'm Dr. Marie Azizian, a board certified general surgeon and IFM-certified functional medicine physician. On this channel, I bring you science-backed natural health tips on functional medicine, supplements, latest medical research to help you feel your best. And if that sounds good, then hit that subscribe button and let's continue. So what is ashwagandha? And why is everyone talking about it? In fact, I think that it's becoming more and more well known by a general public, which is a good thing. Ashwagandha is one of the most powerful herbs in Ayurveda, the traditional medicine system of India. It's been used for over 3,000 years for stress relief, energy, and longevity. The name ashwagandha comes from Sanskrit. Ashva means horse and gandha means smell. Why? Because this herb was believed to give you the strength and endurance of a horse. Well, maybe. And yes, the root has a bit of a earthy smell to it. The plant thrives in some of the harshest environments, just like how it helps our bodies adapt to stress. So a little correlation. So now you might hear the word adaptogen a lot when people talk about ashwagandha. But what is adaptogen? Adaptogens are special herbs that help your body adapt to stress, whether it's emotional, physical, or even environmental. And the interesting part of this adaptation is that adaptogens have a normalizing effect. And it's good to think of them as nature's reset button for your stress response. Ashwagandha is one of the most well-studied adaptogens because it actively lowers cortisol, our main stress hormone. In fact, research shows it can reduce cortisol levels by up to 30%. But that's just the beginning. So let me introduce you to one of our patients who we will call Sandy. Her story is very typical and common. She came to me feeling completely overwhelmed, constant stress, sleepless nights, and that drained, burned out feeling we all know too well. And she said something like, I feel like I'm barely functioning anymore. After we ruled out other medical causes, which is very important to do first, and I suggested she tried ashwagandha, she hesitated. How can a plant fix this? But she gave it a shot. And I also have to premise that she also decided to actively implement meditation and deep breathing into her daily life, and also decided to go to bed on time instead of sitting with her phone into the late hours of the night. So fast forward to a few weeks, and Sandy walked into our clinic smiling, and she told me that she was sleeping better, feeling calmer, and even though her workload hadn't changed, she was handling it all without spiraling into anxiety. And her words were, I feel steady. So what does the science say about ashwagandha? So let's break it down. So it reduces stress and anxiety. It lowers cortisol and helps with mood balance. It boosts brain function. It improves focus, memory, and reduces brain fog. It enhances physical performance, supports stamina and muscle strength. And it balances hormones, helps both men with testosterone fertility and women with PCOS and adrenal fatigue. It also supports immune function in general. It strengthens defenses against infection. And also, there's some research that shows it may have anti-cancer properties. It's because it shows that it could inhibit tumor growth. It's no wonder this herb has been called a life changer by so many people. Now, if you're considering trying ashwagandha, here's what you need to know. It's available in different forms: capsules, powders, and even teas. Dosages typically range from 300 to 600 milligram per day, but it's very important that always talk to your doctor before starting any supplement, especially if you're pregnant, breastfeeding, or have thyroid or some autoimmune conditions. Sandy's story is not unique, and I've seen many people benefit from ashwagandha, and now you know why. But I want to hear from you. Have you tried it? And of course, if you did, or share your thoughts, leave a comment below. And if you found this video helpful, please like, share, and subscribe for more health tips. Thank you so much for watching. Until next time. Bye bye.